The UK has been focused on containing the threat of COVID-19, but it is not the only virus to contend with. In fact, as winter approaches, respiratory syncytial virus, RSV, is proliferating. We are hearing many more reports of extended colds, frequent colds and colds, said Dr. Hilary on GMB on Monday. As Dr. Hilary explained, RSV is a common respiratory virus that usually causes mild, cold-like symptoms. As the weather is cooler, people flock together more, and the lifting of coronavirus restrictions has caused a surge in RSV. Coughs are a common warning sign of RSV, said Dr. Hilary. The situation poses a grave threat to the NHS because, as Dr. Hilary pointed out, there is no vaccine at the present time for RSV. COVID test, the drinks that could lead to a false positive result. According to new study. According to Dr. Hilary, RSV is prevalent among babies, but it can be passed on to adults too. Most people recover in a week or two, but RSV can be serious, especially for infants and older adults, warns the Centers for Disease Control and Prevention, CDC. RSV is the most common cause of bronchiolitis, inflammation of the small airways in the lung, and pneumonia, infection of the lungs, explains the CDC. Bronchiolitis is a common lower respiratory tract infection that affects babies and young children under 2 years old. Pancreatic cancer, signs to look for when you go to the toilet, insight Parkinson's, 2 lifestyle behaviors that double your risk, advice dementia symptoms, 7 early warning signs, tips. The symptoms to spot people infected with RSV usually show symptoms within 4 to 6 days after getting infected, notes the CDC. Symptoms of RSV infection usually include runny nose, decrease in appetite, coughing, sneezing, fever, wheezing. These symptoms usually appear in stages and not all at once, says the CDC. In very young infants with RSV, the only symptoms may be irritability, decreased activity, and breathing difficulties. However, in severe cases, RSV infection can spread to the lower respiratory tract, causing pneumonia or bronchiolitis, warns the Mayo Clinic. Severe signs and symptoms may include fever, severe cough, wheezing, a high-pitched noise that's usually heard on breathing out, exhaling, rapid breathing, or difficulty breathing. The person may prefer to sit up rather than lie down. Bluish color of the skin due to lack of oxygen, cyanosis. As the Mayo Clinic points out, because RSV and COVID-19 are both types of respiratory viruses, some symptoms of RSV and COVID-19 can be similar. In children, COVID-19 often results in mild symptoms such as fever, runny nose and cough, explains the health body. As it explains, having RSV may lower immunity and increase the risk of getting COVID-19, for kids and adults. And these infections may occur together, which can worsen the severity of COVID-19 illness. The Mayo Clinic adds, if you have symptoms of a respiratory illness, your doctor may recommend testing for COVID-19. Seek immediate medical attention if your child, or anyone at risk of severe RSV infection, has difficulty breathing, a high fever, or a blue color to the skin, particularly on the lips and in the nail beds.